Hello dear students, welcome back to my YouTube channel Physiology Learning. In this video we are going to continue with our cardiac cycle because in the last video we have just understood what are all the events that is happening in the cardiac cycle. Here we will be analyzing the Weiggers diagram as well as the flow volume loop curve. So whenever there is a question of cardiac cycle, so you can write them under this heading. So this is the summary of cardiac cycle. First the definition and duration, which we already saw. And the phases, the inflow phase, outflow phase, either you can write it in inflow phase and outflow phase, or you can also write it along with the lines of atrial systole, atrial diastole, ventricular systole and ventricular diastole. We saw that in ventricular systole it is nothing but the isovolumic contraction and the ejection phase, whereas in the ventricular diastole it is the isovolumic relaxation and the filling phase. Today we are going to see about the Weiggers diagram and the flow volume loop curve. So almost these two diagrams are very similar. The flow volume loop curve is just a modified version of some of the activities of the Weiggers diagram only. So coming to the Weiggers diagram, so what we are going to do is, Weiggers diagram, when you see it directly from the books, there are around 6 curves. Now what we are going to do is, we are going to split them each and understand them each and finally go to the main diagram and recap it. So here there are 6 curves. Out of that, there are 3 pressure curves. So the pressure curves, it will indicate the ventricular pressure, then the aortic pressure and the atrial pressure. So we have 3 pressure curves, the ventricular pressure curve, aortic pressure curve and the atrial pressure curve. And the rest 3, we have other things, that is the ventricular volume, the ECG and phonocardiogram. So this ventricular pressure curve and the ventricular volume curve, there will be inverse of each other. For example, when the ventricular pressure is too high, it is going to cause the ejection phase and the blood is going to be ejected. So whenever the pressure is so high in the ventricle, the volume will become less in that. And whenever the ventricle is relaxing, the ventricular filling will happen and the volume will increase. So they will be the reverse of each other. And aortic pressure curve we will see. Then the atrial pressure curve, we are just going to see a brief discussion about here, but further discussion that will be done in the JVP, because the atrial pressure are exact mimic of the jugular venous pressure. So the atrial pressure is indirectly represented by the JVP. And ventricular volume curve we will see, and ECG I will just give a brief intro here, whereas the final ECG will analysis of the waves and everything will be done in the ECG chapter. Then phonocardiogram is recording of the heart sounds. We will try to pinpoint where the heart sounds are lying in the different phases of the ventricular pressure curve. So now coming to the pressure curve, first we are going to discuss about the ventricular pressure curve. Since we have already discussed the cardiac cycle, if somebody has not watched that video, I would suggest you to watch that first and come back to this video, because that is the basis of this curve which is formed here. So always whenever you are trying to analyze a graph or draw a graph, first make sure that what is there in the y-axis and what is there in the x-axis. Here the x-axis, we are going to indicate the duration or the period of systole and diastole. So this area will indicate the systole and the following area will indicate the diastole. So this is going to be our diastolic period, diastole. So this is the systole and diastole along the x-axis, and along the y-axis we have the pressure curve. In the pressure curve, the important pressures are 0 pressure, wherein the ventricle is completely relaxed, and 80, which is the pressure required to open up the aortic valve, and 120, it is the maximum pressure during the systole. We are talking about a normal individual. So first, there is a slight elevation in the graph, as you can see here. Why is this happening? Because atria is contracting and giving the blood to the ventricle. So this is the filling due to atrial contraction, and it gives a slight increase in the pressure. After that, we are landing up with the volume, that is nothing but our end diastolic volume. After that, which happens? The ventricle starts to contract. As and when the ventricle starts to contract, the blood from the atria has reached the ventricle. Now the ventricle is contracting. What will happen? First, the AV valve is going to close. So here the AV valve will closed. Then after that, the AV valve is also closed, as well as the aortic valve is also closed, which we saw it in the graph of the explanation of the cardiac cycle. So the AV valve is also closed now. And the aortic valve is still closed because at the diastole itself the aorta will have 80 mm of Hg. Now both the valves are closed. So what is going to happen? The ventricular pressure is going to keep on piling up, and pressure is increasing up to 80. Once it reaches 80, which valve is going to open? The aortic valve is going to open. Aorta opens. Then after that, this is the ejection which is happening. First the rapid ejection, then the slow ejection. After that, when the pressure falls below that, what is going to happen? The aortic valve will closed. Aortic valve is closed. So this phase where the pressure is rising and the volume is same because both the valves are closed, that is the isovolumic contraction phase. And in a similar manner, when the aortic valve is closed, already the AV valve is closed, it is still not open. This phase is called as the isovolumic relaxation. All this explanation we have seen it already. This is the graphical representation of it. So it keeps on, the pressure keeps on coming down, and finally when the pressure falls below 5 mm of Hg, here we are going to open up the AV valve opening. AV valve opening is going to happen, and this is the ventricular diastole where the ventricle is going to relax. So this is the ventricular pressure curve. It is pretty simple. Whenever there is an end diastolic volume, both the valves will be closed. So the pressure is going to rise, giving into the isovolumic contraction phase. And after that, the blood is ejected, ejection, then starts the diastole. Then first the diastole, we have the isovolumic relaxation. It will keep on relaxing and the AV valve will open and the filling will happen. So this is the diastolic period. So the ventricular pressure curve is done. Now from this diagram itself, we can understand and analyze where the heart sounds will happen. As you can see here, second we have mentioned the phonocardiogram. Phonocardiogram we will again discuss in the heart sound chapter also. But phonocardiogram is an instrument which helps to record the heart sounds. Obviously we can use a stethoscope also, but in a stethoscope only the S1 and S2 will be heard. But in a phonocardiogram it might record the S3 and S4 if it is heard. In some individuals S3 might be heard physiologically, but S4 is most of the time pathological lesion. So where it will fall, let's see. Whenever the AV valve is closed, what is going to happen? It is going to create a heart sound, that is the S1. So S1 sound will fall here, and the S2 is because of the aortic valve closure. So the S2 will fall here. Then after that, the rapid filling happens. So the S3 is going to fall here. And in the slow filling phase, there is not going to be any sound. So the slow filling phase, there is no sound. And finally, the filling due to atrial contraction, the S4 can be heard. So these are the 4 heart sounds. Again, we will discuss the characteristics of these heart sounds in the next video. But here, we are just trying to match the heart sound with the phases of the ventricular pressure. Then I told you one more thing. Whenever the pressure is high in the ventricle, the volume is going to be less. So as you can see here, when the ventricular pressure has gotten in very high and the blood is being ejected, at the same time the volume curve, the volume is going to drop down. So in a systolic period, the ventricular volume is going to come down, and 130 ml is the ml wherein the end diastolic volume is there, Then after the ejection phase, after the ventricular pressure is raised, it is just pumping out the blood and the blood has come out. So what is happening? The end systolic volume will come. The end systolic volume is around 50 ml. So this is our end systolic volume. So now this is the end of systole where the 70 ml is thrown out, and after that the filling starts, and you can see the filling curve. It happens in 3 phases, 1, 2 and 3. The first one, as we know, it is a rapid filling phase. The second one is the slow filling phase, also called as diastasis, and third phase is due to the filling due to the atrial contraction. So as you can see here, the curve is just mimicking the opposite of a ventricular pressure curve. But in this area, the pressure is also raised, the volume is also raised. That is because pressure is generated from the atria. The atria is pumping and pushing the blood into the ventricle, creating a slight increase in pressure as well as the volume. That is not the ventricular pressure, that is increasing the ventricular pressure because of the atrial contraction. So this is the ventricular volume curve. So we are done with ventricular pressure, ventricular volume, phonocardiogram. Now coming to the aortic pressure. Aortic pressure is pretty simple. Aorta is always at the pressure of 80 even in during a diastole because of the effect called as Wind-Kessel effect. So the aorta is an elastic tissue. So because of the recoil, during a diastole, it is generating a pressure that is the minimum pressure of 80 mm of Hg. So the aortic pressure curve, we just need 80 and 120. It will not go below that, because in a normal person, even during the diastole, the aorta will have 80 pressure. So as you can see here, when the ventricular contraction is happening, the aortic pressure also from 80, when the aortic valve is opened, it will also keep on increasing, and it will ejection phase, rapid ejection phase and slow ejection phase will happen. Then after that, the pressure starts to fall. Ideally, the graph should have followed the line, dashed line which I have drawn now. But what is happening, instead of this narrow fall, what has happened, as you can see here, there is a slight rise here and then there is a fall. This slight rise, this area in the aortic curve, aortic pressure curve, is called as aortic incisura. Incisura. What is this aortic incisura? Why is it happening so? Ideally, the pressure raised and it should have fallen just like that. But there is a slight elevation again. So that is happening because in the aorta, the blood is being ejected, and when the aortic valve shuts, what is happening? Because the blood is coming and hitting this shut valve, there is a generation and slight increase in pressure. So that is why the pressure increases a bit and then comes down. So that is because of the closure of the aortic valve, and the blood just hits it and just increases the pressure. So this is all about the aortic pressure curve. Then the atrial pressure curve. Atrial pressure curve is very simple. It has three waves, that is the A, C and V. These are the upstroke waves. This again we will discuss in the JVP, but right now I will just explain the upstroke waves. So A is for atrial contraction. So whenever the atria contracts, there is a slight rise in pressure. So A is nothing but a atrial contraction. And next, C, just remember it with the mnemonic C for cusp. So what is the cusp? The cusp, the mitral valve or the AV valve, whenever it closes, there is a slight elevation of the pressure. That is because of the AV valve closure. Just as above I explained the incisura, whenever the valve closes, there is a slight hit of the blood and then it increases the pressure. And V is because when the atrium is relaxed and the venous return comes, there is a slight increase in pressure. Now it has relaxed, but it is receiving the blood, and that incoming blood is creating some pressure. So the V is nothing but venous return. Venous return. Again, this atrial pressure we will again study in JVP in detail, like the descent part also. But for now, we have three upward strokes, A, C, V. Then ECG we are not going to discuss in detail. ECG is an electrical activity which precedes the contraction. So just before atrial contraction, I will have a P wave. This is the atrial depolarization, that is a P wave. Then just before the ventricular contraction, I will have the QRS complex. Then just before the relaxation, I will have the T wave. So ECG wave generation and everything we will discuss further in the ECG lectures, but here the QRS complex precedes the ventricular contraction, because QRS is nothing but the depolarization of ventricles, whereas P wave is due to depolarization of atria and T wave is due to repolarization of ventricles. So in ECG discussion, we will make a detailed description of why these waves have occurred, but here it will just precede the activity. So now we have done all the 6 curves. We have done our ventricular pressure curve, then phonocardiogram, ventricular volume, aortic pressure curve, then the atrial pressure, then finally ECG. Now let's have a look at this Weiggers diagram. Just a small recap. The ventricular pressure curve is the one which we discussed further first time. First the pressure will increase because of atrial contraction, then isovolumic contraction, then ejection, then isovolumic relaxation. This we have done it. And the ventricular volume curve, as you can see here, it is just mimicking the opposite. It is just like the opposite of it. Whenever the pressure is high, the volume is coming down. And the aortic pressure curve, we just have to remember it is between 80 and 120. As you can see here, it is between 80 and 120. It never falls below that, the curve itself. Then we discussed about the atrial pressure curve, and the phonocardiogram sounds are matched, just like we have mentioned. Here S4 is not mentioned because it's not normally here, but it will fall in this period. So this will be the 4th heart sound if it is heard. Then as you can see here, the P wave precedes the contraction, precedes the contraction, and the QRS complex precedes the ventricular contraction. And this T wave happens below the relaxation. So the ECG is just preceding the waves. So once you know the individual diagrams, you can put them, and once you practice once or twice, you will be able to draw this Weiggers diagram. So when cardiac cycle is asked, try to draw the Weiggers diagram so that it gives an additional benefit, and it shows that you have learned the curves well. Now the Weiggers diagram is also represented in a loop volume curve. So this is the ventricular pressure volume loop curve, pressure volume loop curve. So what we are trying to do is, here also we will assess the ventricle, but we will be studying the ventricular pressure against the y-axis and ventricular volume against the x-axis. So it will form a loop kind of thing. So let's try to understand. First, always look at the x and y-axis. In the x-axis, we have the ventricular volume in ml. In the y-axis, we have the pressure, that is the ventricular pressure. Normally, the ventricular pressure can be 0 also, but whenever there is a slight rise in the volume, it comes to around 5. And in the volume curve, we have represented two volume, that is 50 and 120 ml, maybe 130 ml also it can go. This 50 is nothing but end systolic volume. This 50 is nothing but end systolic volume. This 120 is end diastolic volume. When the filling happens, it comes to 120. Then in the pressure side, we just need 80 and 120 for our representation. That is under the mm of Hg, because rest of the values, whatever is inside, that generally they are passed while the contraction is happening, and 5 mm at the baseline. So first, after the systole, there is some amount of blood. Even after the systole, there is some amount of blood. So then what happens? The filling happens and it reaches the end diastolic volume. Once it reaches the end diastolic volume, what is going to happen? Both the valves will be closed, so there will be an isovolumic contraction. So once it reaches this isovolumic contraction, the final phase, the aorta will open and it is going to cause the ejection phase. Then after the ejection, then the pressure will fall again, then the aorta will close again, then it will keep on coming down and reach this value again. So let's label them, then try to understand what is happening at each point. A, B, C, D and E. So let's understand what is happening at every single point. At A, we are having an end systolic volume. So after the systole, the ventricle will start to relax, and which valve will open? The valve, that is the AV valve, will open. Or here we can say that mitral valve is open, because we are discussing the left side of the heart. Then what is happening? It starts to fill, and finally we will reach the end diastolic volume. After the end diastolic volume is reached, there will be contraction of the contraction of the ventricle, which will lead on to the closure of AV valve closure. So point D, somewhere near point B, it is the end diastolic volume. When the contraction starts, AV valve is closed. Now the AV valve is closed, aortic valve is already closed because it is under the pressure of 80. Slowly the ventricle will start to increase the pressure, keep on increasing. So isovolumic contraction is happening. At the point C, what is going to happen? The aortic valve will open. Then from C to D, that will be the rapid ejection, and D to E, that is a slow ejection. And at point E, then aortic closed. Aortic valve is again closed. So aortic valve is closed. As you can see here, this is just the same ventricular loop curve which we studied in the Weiggers diagram, but we are comparing at the pressure and it is forming a closed loop. Now, one way of representing is at the points. Next thing, the same diagram, we will understand what are the events happening between 2 points. For example, what is the event happening between A to B, B to C and C to D, D to E as well as E to A. So let's try to understand the events. From A to B, what is happening? The ventricular filling is happening. Ventricular filling. Then from point B to the point C, what is happening? There is isovolumic contraction because both the valves are closed. Simply the pressure is increasing, that is isovolumic contraction. Then C to D, it is the rapid ejection phase. Then D to E is the slow ejection phase. Then from E to A, now again the aorta is also closed, the AV valve is already closed. So E to A will be the isovolumic relaxation. So the same diagram, we are representing the events across different points. So this is another way to represent this diagram. So this is the flow volume loop curve of the cardiac cycle. So in the cardiac cycle, first we learned about the definition and various phases, then we understood the Weiggers diagram, and finally the flow volume loop curve. So whenever a cardiac cycle is asked, it is a must know area, and sometimes we will discuss what happens to this flow volume loop curve in diseased patients also. So this brings us to the end of cardiac cycle. I hope it's clear. If you have any further doubts, please drop it in the comment section. I'll be happy to answer your doubts. Thank you so much for watching the video. We'll see you in the next video. Thank you so much.